All right, hello. Thank you for joining us today for this webinar on completing the WPS prior authorization request forms. My name is Mary Sue Gardner, and I'm a registered nurse on the Provider Outreach and Education team. And I'm joined today by Jennifer, who's the other nurse on the Provider Outreach and Education team that is going to be assisting me with the chat as well as the question and answer portion of today's call. Today's event will be a lot of show and share time. So I want to actually take you out to the actual resources and show you how to use them. So if you're following along with the slide deck, we're going to be doing a lot of back and forth to take you to those actual resources. So it will probably just benefit you more just to follow along with what is on the screen. For all of our events, we have to provide you with our disclaimer for our event. And our disclaimer basically says we prepared this education as a tool to assist you, our provider community. And please be aware, Medicare rules often change. The laws, rules, and regulations as they stand today are how we created this event. But if the laws, rules, and regulations happen to change tomorrow, it's your responsibility as a provider to make sure you are following what they are on your date of service. We are going to provide questions and answers based off the facts given. But the Medicare rules will determine final coverage. Also, CMS prohibits recording the presentation for profit-making purposes. So if you are recording, we do ask that you stop recording, but we are recording it for you, and we will be placing it on our YouTube channel within 15 days of this event. Jennifer, I see a question came in about someone that's having issues hearing. Can you hear me?
Yes, I can. So I will send her a private message.
Perfect. Thank you so much. I just wanted to verify before we got too far in if there's any other audio issues. All right. Let's go ahead and keep moving. So on your screen right now, as well as in your slide deck, is a list of acronyms that I may or may not say during the course of this call. But they're here for you, and if I happen to use an acronym, because Medicare is like acronym soup, and you don't maybe know what that acronym means, I do ask that you go back and refer to this acronyms list. My objective for today's event is to show you how to complete the prior authorization request forms properly and to help you get affirmed decisions on your first try. We're going to achieve this objective today by briefly discussing the prior authorization processes, as well as show you how to locate both the Hospital Outpatient Department prior authorization request, or HOPD, as well as the repetitive scheduled non-emergent ambulance transport, or RSNAT request forms. So from here on out, I'll use HOPD and RSNAT, probably instead of saying the full name. We're going to talk about how to, complete these forms. All right, so moving on. Before we move into the actual forms themselves, let's talk about the processes. The purpose of the prior authorization processes is to allow providers the opportunity to receive a provisional affirmation to perform the service before the service date. So requests for prior authorizations must be made before the service is performed. It's not a guarantee of payment. So I want to make that clear. It's not a guarantee of payment. An affirmed decision basically says we agree at this time that you can perform this service in the future, that you've agreed to meet the coverage criteria for performing this service. The service, however, when performed, still needs to be done following all coverage criteria, so it must meet medical necessity at the time it's performed, and the documentation and the billing also need to meet the coverage criteria. So once you bill the claim, the billing of it could still hit other system edits, especially if there's something that's billed inappropriately that could cause a denial of service. And documentation is always subject to medical review. So if your claim hits a medical review edit, it could be subject to medical review, even though you've received a provisional affirmation prior to performing the service. So that's why we stress it's not a guarantee of payment, but instead a provisional affirmation for you to perform the service. So let's discuss a little bit about the prior authorization programs under Medicare Part A and Part B. There are other prior authorization and pre-claim review initiatives under Medicare for home health and hospice, as well as durable medical equipment. But WPS Health Solutions, we do not have a home health and hospice contract, nor do we have a DME contract. So those services don't apply to us. Under traditional Medicare, Parts A and B only have a prior authorization process for the HOPD for Part A, the Hospital Outpatient Department services under Part A, and for RSNAT, or those repetitive scheduled non-emergent ambulance transports under Part B. There is not a medication prior authorization process under Part A or Part B for traditional Medicare. And that was one question that came up prior to today's event that I wanted to make sure that I touched on. So there could be one under one of the replacement plans that I would not know about. But for traditional Medicare, Part A and Part B, that does not exist. So one of the first things that does apply in the prior authorization program of PD services, let's talk about those first. So HOPD services, hospital outpatient, this is a Part A review. So the responsibility of the prior authorization is on the facility performing the service. The hospital outpatient department is the one that's responsible for obtaining and making sure that the prior authorization request is done before providing the surgery at the hospital in the outpatient department. There are actually 8 different services under the HOPD program, and these include blepharoplasty, botulinum toxin or Botox, peniculectomies, rhinoplasties, vein ablations, cervical fusion with disc removal, implanted spinal nerve stimulators, and facet joint interventions. Remember, this is only in place of Service 13X, Hospital Outpatient Department. This program does not apply to any other place of service. So if you are not performing one of these procedures in the outpatient department of a PPS hospital, it doesn't apply. So to make this clear, critical access hospitals, outpatient critical access hospitals, physician's office, ambulatory surgical centers, or any other facilities such as a skilled nursing facility, etc., this does not apply to you. So know that right off the bat. You're a physician who is going to be performing one of these services in the hospital outpatient department. The service does not apply to your billing. This is only for the hospital outpatient department who bill their claims on a 13X type of bill to Medicare Part A. So I don't want to confuse you into thinking that a physician's office can't submit a request on behalf of the hospital. They most certainly can. However, the provisional affirmation is not granted on the physician's billing. The provisional affirmation is granted on the facility who's going to perform the service. So now let's switch gears a little bit and talk about the RSNAT, or Repetitive Scheduled Non-Emergent Ambulance Transports. The RSNAT process is a Part B review process. So this process is specific to ambulance suppliers that are not institutionally based. In this process, again, a provisional affirmation for coverage is being requested before the service is furnished to the beneficiary and before the claim is submitted for payment. Let's remember, ambulance transports are a transportation benefit. The medical necessity of the benefit must be met each day of the transport, which means the transportation by any other means would be contraindicated to that person's health and well-being. So besides being medically necessary on each day of service, the transport or service must also meet all other Medicare coverage and payment requirements. So that's related to like origin and destination and vehicle and staff and your billing and reporting. The repetitive ambulance service is defined as a medically necessary ambulance transportation that's furnished in 3 or more round trips during a 10-day period, or at least 1 round trip per week for 3 weeks. So these types of repetitive ambulance transports are most often needed by beneficiaries receiving things like dialysis or cancer treatments. Medicare may cover the transportation when medically necessary, and the ambulance supplier obtains that written order from the attending physician certifying the medical necessity requirements are met. So the prior authorization process for RSNAT services is also voluntary. However, you have to note that if the ambulance supplier elects to bypass the prior authorization process, then you need to know that any applicable repetitive scheduled non-emergent ambulance transport claims will be subject to prepay medical review. And the claims for the first 3 round trips or 6 one-way trips are permitted to be billed without prior authorization. So for one beneficiary, 3 round ways or 6 one-ways are permitted without prior authorization and without being subject to prepay medical review. But all those repetitive services after that 3rd transport, that 3rd round trip, will be stopped for medical review after that if you do not participate in the prior authorization program. That's why we really encourage our providers to participate in the program. So again, a few just additional things. This process applies to the ALS non-emergent transports and the BLS non-emergent transport codes. It does not apply to the mileage code. So the A0426 and the A0428, but not the A0425 mileage code. Just a little more about the provisional affirmation. Again, it's a provisional prior authorization of a specific number of trips within a specific amount of time. We can affirm up to 40 round trips or 80 one-ways per 60-day period of time. And we can affirm all or part of the requested transportations that you request. If you need more than that, then you will need to submit additional prior authorization requests. So as a MAC, we could allow for extended affirmation periods for beneficiaries with chronic medical conditions that are deemed not likely to improve over a period of time. But the medical record really must clearly indicate that condition, that it's chronic, and we have to see that there's prior trips before that, prior requests made, at least 2 prior requests before that, before we would even consider that. Again, and then we could affirm up to 120 round trips in a 180-day period. Again, I want to stress that the RSNAT process is specific to ambulance suppliers who are not institutionally based, who are providing Medicare Part B covered ambulance services, and those are billed on a CMS 1500 claim form or its electronic equivalent, such as a 837P. If an ambulance supplier is under review by the UPIC, they're not eligible to participate in the prior authorization request. Hospital-based ambulance providers, if they're owned and operated by a hospital or a critical access hospital or a SNF or CORF, which is a comprehensive outpatient rehab facility, home health agency, et cetera, this program is not for them either. So I just wanted to provide all the background to make sure I spoke about these prior authorization processes and who they're specific to and why they're specific to those before we move into talking about discussion of the forms. All right, so the slide on your screen and in your slide deck, this slide just contains pictures of each of the prior authorization request forms that we have available. We're going to move into talking about each of these request forms and actually how to complete them. So the title of this slide is actually a hyperlink to the actual form. Before we jump out there, let's just review some quick information from this slide. When completing this form, regardless of if you are the facility completing it for yourself or the physician's office completing it on behalf of the facility, all information must be completed on this form. So this includes any additional information or write-in information that may help us better understand what you're doing and help you better describe what you are doing. And those could include things such as listing the exact location that the service is going to be performed on. So like if you think of facet, what level are we doing? Same as implanted nerve stimulators. Things like if the service is diagnostic versus therapeutic, that's additional information that we need to have. Again, back on the facet, is it a medial branch block? Is it intra-articular? Or is it an RFA or radio frequency ablation? Also, is this a repeat service? Those are just things on the additional information that could really benefit you as a provider to make sure you are documenting. So on your screen right now, I have just linked to the hospital outpatient prior authorization request form. And I'm going to jump back into, let me go to the WPS GHA website and just kind of show you quickly how you can get there without using that link provided. Now, when I go to WPSGHA.com, this is the landing page or the home page, whichever you want to call it. Since HOPD is a Part A service, I'm going to select a Part A jurisdiction. I'm just going to select J5 because it's first. I'm going to then select forms as a quick link because this is the fastest way to get there. And I'm going to scroll down to prior authorization, which I went by very fast. There we go. And open that. And then from here, you can download the prior authorization and it will come up for you. So the hard copy request form is what's on the screen right now. So when you are completing this form, there's a few things that you want to make sure that you are doing. First of all, mark your jurisdiction. Are you J5A? Are you J5 National A, which means you're still part of WPS, but you're not Nebraska, Iowa, Kansas, Missouri. Or are you J8, Indiana or Michigan? Your date and then your service. You're going to want to then tell us, is this an initial? Is this a resubmission? And if it's a resubmission, what was the prior unique tracking number that you received? Also, is it expedited? Now, and I'm going to give you directions on this, but expedited requests should only be for the fact that delaying this procedure to allow time for us to make a review decision would jeopardize the health and well-being of your patient. It's not to be used when someone forgot to submit the form or you want to sneak in surgery quickly. So you have to be cognizant of your time frames as well. All right, so as we go through, facility and physician information, all of this information needs to be completed. So if you happen to be the physician's office submitting on behalf of the facility, you need to make sure you have the facility's NPI, the facility's PTAN, contact at the facility, actual address, fax number, etc., as well as go down and you have to fill out the beneficiary information regardless of if you are facility, physician, etc. And then down here, this is where you're going to start telling us what service you're providing or anticipate doing. Which HCPCS code are you planning on doing? Is there a modifier associated with that, especially if it's a right or a left? Or a bilateral modifier. Make sure you include that information. If you are unsure about which procedure it may end up being once your physician gets in there, you may need to request multiple HCPCS codes be considered for prior authorization if there's a chance that it may change interoperatively. And then your requester information, etc. Now down here, again, is where we give you the opportunity to give us all that additional information. You have to remember with especially things like facet interventions, the codes don't give us the whole story. So you need to give us that information. It needs to be supported in the documentation as well. Is this a first injection? Is it therapeutic? Is it diagnostic? What type of injection? Is it MBB? Are we doing interarticular? Is it an RFA? If you're doing vein ablations, where is the location of that vein, etc. So do be cognizant of the CPT codes and the descriptions. And if it is not accurately described, give us that additional information here. It's only going to behoove you to do that and benefit you for doing that, or benefit you in doing that to make sure you have a better chance of getting a provisional affirmation on the first request. I'm going to jump back briefly to the slide deck just to move on and show you, next we're going to talk about the portal request form, excuse me. Again, you're linked up here, but this link is going to take you to the portal user manual because I can't log into the portal. I'm not a user. I don't have access to that. Plus, it would provide you with information that potentially I could be releasing PHI or PII. So we can't get into the provider user portal. But the next best thing I can show you is what it looks like right now to complete the form. And I'm just going to use the examples in the portal user manual. Now, I went all the way, and my slide links you all the way to the portion of the portal user manual that's on prior authorization. However, in the absence of having my slide deck, remember you can always get to the portal user manual right here. This login information is going to remain at the top of every page on our website until you have logged in. So again, user's best friend right here is portal user manual, and it's right there and available for you. So as we move through the information in the portal user manual, I just kind of want to go through and show you what information is available for you here. And we're still talking about the HOPD services at this time. So it kind of gives you information on what services are included, as well as under the RSNAT program, what services are included. Moving down under submitting a prior authorization request. And I do want to pause for just a second to say this is what it looks like right now. We are making updates to our portal section, just as we did make updates to our open section of our website to enhance the look and feel for our users to help you better find things. We are making enhancements to the portal side as well. So coming soon, hopefully around the end of October, you are going to see that the portal changes. The portal user manual will also be updated to reflect those changes, and we're going to do a plethora of education to make sure that you, our provider community, are on track and know where to find things. But right now, when you go in and you log into the portal user, you have on your left navigation a box that says My Correspondences, and you can go down and find prior authorization, and it's down here under there. Once you click on the prior authorization, you have the opportunity for a prior authorization request. So as you go through, you can see besides, your service location, your MPI, and selecting the type, in this case, it would be the HOPD, because that's what we're talking about. Then you have all the same information that you have to fill out on the request form if you use the hard copy form. So PTAN, address, beneficiary information, requester information, physician information, etc. One thing I do need you to note is that if you are a physician's office submitting on behalf of a facility, you cannot submit via the portal. This is for the Part A facility because it's a Part A process. So you can't get in unless you were to have access to the hospital's provider portal, which I'm pretty sure they're not going to allow physician's office access to, because then you have access to all their claim information. But you would have to submit the hard copy form. But again, here's that additional information right here. So any additional information, size, therapeutic versus diagnostic, level, first injection, any of that helps further describe what you're doing it's only going to benefit you to include all that here. Again, however you're filling out the request form, make sure you fill out every single line on those request forms. All right. Now, in the interest of time, I'm just going to show you under here how the RSNAT information is also the same. So if you just scroll down beyond step 8, it has the same information for repetitive scheduled non-emergent ambulance transports if you're filling those out online. Again, it all looks pretty much the same as it did for the HOPD services, where you have to choose your type of service, but then your information boxes that you have to fill out are going to be more geared towards this process itself. Again, here's the supplier information and supplier address for that ambulance supplier, beneficiary information, requester information, and then down here, who the certifying physician is and their information. Again, additional information, anytime you can give us any more information, it's only going to benefit you. Just like in the HOPD services, then you have the opportunity to upload the file. But again, remember, these are for ambulance suppliers that are not institutionally based. Now, instead of going back to the slide deck to show you the hard copy RSNAT, I'm just going to go link back to the home page. And I did that by hitting the icon. And I'm going to then select J5 Part B, since RSNAT is a J5, or since RSNAT is a Part B process. I'm then going to use a quick link into forms. I'm going to go down into prior authorization, and then down here you can see the form for RSNAT. Again, download it. Jumping back just a second, please read this information. It gives you some of these tips that we're talking about today that'll help ensure a successful submission on the first time. All right, so it's not wanting to re-download for me, probably because it's open somewhere up here. There we go. All right, again, initial, it's a resubmission. Now, the thing I do want to tell you about is that expedited request for prior authorization of RSNAT services is going away because there's really no need. These are non-emergent ambulance repetitive transports for the future. So there's no need for the expedited request because delaying because of a review time frame may jeopardize the health of your patient since they're non-emergent. What is also happening come January 1st or right there after the first of the year is that our time frame for review is also being reduced to 7 calendar days. So instead of us having 10 business days, we will have 7 calendar days in which to make a review decision. Since there's multiple prior authorization processes, you could probably expect that CMS will make the same type of decisions for the HOPD services, but we do not have any information on that yet. But as of now, prior authorization for RSNAT services after January 1st, a reduced time frame for us as your review contractor, and the elimination of the expedited review. So just as in the portal, you need to fill out all the information on the request form. Please note, and this is in that stuff that I told you to read on the page before this, the number of transports you're requesting. you need to tell us how many transports in total. So if you're thinking round trips, you need to tell us how many that is in one-way trips, all right? So if you're planning 40 round trips, that's actually 80 one-way trips, and your request should be for 80. And then when is the start period of your 60 days for this service? Again, the procedure codes, whether it's the BLS or the ALS, and any ambulance modifiers that go along with it. You do not have to give us the mileage codes. That's not pertinent to this. And then go down through as well as all the information from the supplier, the beneficiary, certifying physician, etc. The thing with the prior authorization request for the RSNAT services that make yours unique is the physician certification component. So we have to have an actual certification from your physician for the repetitive scheduled non-emergent ambulance transport. So from the physician who is taking care of the patient. We have a sample RSNAT or a sample PSC form on our website. I am just going to show you the easiest way to find it. And if I go into PCS and I do a general search, because I'm a searcher, I'm really not a navigator type person. And you know what, actually I'm going to spell it all out, sorry. Physician certification. Oops. And if I would spell right, physician certification statement. Yeesh. All right, and then I download this. We've created a sample form for you to use. You can use this form that's located on our website and create something for yourself, or use this form if you want. This gives us all the information to help support the medical necessity of your repetitive scheduled non-emergent ambulance transports. So all the information and what the physician is saying that this patient needs on these days of service that would make it contraindicated for that patient to go by any other means of transportation. So again, there's contractures? Is there some side of paralysis that inhibits the patient from sitting? Are there special handling positionings that need to be done for the patient? Like, do they have ulcers that they cannot sit in a chair or a wheelchair? Maybe decreased level of consciousness that would make them fall over or unable to sit in a chair and make it not safe for them. Seizure prone, ventilator dependent, etc. Basically, what does the physician need monitored, performed, etc. during the transport that makes that way of going to that, maybe it's the chemo appointment, or maybe it's the dialysis appointment. What makes that the only safe way for that patient to go? So this is the other big piece of information that is going to benefit you when completing that request form for the prior authorization of the repetitive ambulance non-emergent transport, RSNAT. It's such a mouthful to say. Okay, so let me jump back out to the slide deck. We've already covered the HOPD and the portal, and we also went through the RSNAT, and we said make sure you complete everything. We showed you that sample PCS just now too. I wanted to do all of that while we were out on the website already. And then we also looked at the RSNAT request form and, you know, the fields that need to be completed. So that takes us to the end of the formal presentation. This is just a list of resources that if you perform either of these services, these are, you know, of utmost value to you. So I do encourage you to go through and click through these resources at your leisure and, you know, make sure you have a good understanding of those processes. So just a quick recap. After participating in this webinar, you should now be able to successfully complete those prior authorization request forms. So we achieved this objective today by discussing those processes. We went over those forms and how to locate those forms and how to properly complete those forms, including the additional information that's so often missed that makes claims often not eligible for provisional affirmation on the first request. So at this time, I'm going to look over, and I do not see in the chat any additional questions. So I'm going to keep moving on in the interest of time. So on behalf of myself and Jennifer, as well as all of Medical Review, we want to thank you for your participation in today's event. This concludes our webinar, and you may now disconnect.